Welcome to Understanding, Assessing, and Managing Pain in Older Adults. This series was developed for educational purposes and consists of 13 brief presentations that provide an overview of different topics related to pain. At the end of each presentation, there are 3 quiz questions to test your knowledge of the material covered. We'll begin by describing some of the common misconceptions about pain in older adults. In this session, there's only one learning objective: to identify and correct 3 common misconceptions about pain in older adults. Pain in this population is often underreported, underrecognized, and undermanaged. The first misconception is to think that older adults don't feel pain the same as younger adults. This assumption might stem from the way older adults behave when in pain, particularly those with depression, fatigue, dementia, or those with motor impairments, such as after a stroke. Some people lack the verbal or cognitive skills to clearly report pain or understand questions asked. Older adults may not want to bother healthcare providers or may not want to worry their families, and therefore they may be less willing to tell others when they're in pain. Recent research has demonstrated that with advanced age, changes develop in the nervous system that alters how sensory information is processed. With increased age, there is a reduction in the central nervous system's ability to dampen or reduce activity from nerves that carry information about danger to the body. This means that instead of being less sensitive, older adults may actually be more sensitive to some stimuli. So although the nervous system may function somewhat differently with advanced age, and some older adults may be less willing or able to show pain behaviors, a large proportion of older adults live with pain on a regular basis. A second misconception is to think that if an older adult with dementia can't remember a painful event, that pain therefore doesn't matter. A caregiver may think that it's okay to rush through a movement or blood draw, that the older adult will forget about the event like it never happened. Even if the memory for the event cannot be recalled, undermanaged pain has many negative consequences, such as making the nervous system more sensitive or making the older adult fearful or aggressive during physical contact, even with gentle contact, like a hug from a family member or assistance with care. Undermanaged pain puts the older adult, staff, and other caregivers at risk of harm. Not only does pain contribute to suffering, it also interferes with mobility and function, and reduces the ability to participate in self-care or activities of daily living. This requires increased effort from caregivers to provide care and makes it harder to perform lifts and transfers. Lack of mobility from pain or fear of movement puts people at increased risk for infections, constipation, skin breakdown, and falls. The effects of pain on mood may lead the older adult to withdraw from social interaction, or lead to aggression towards staff, family, and other residents. For family and friends of the older adult and staff, bearing witness to suffering can be morally distressing. This can reduce job satisfaction for staff and be a profound emotional burden for family and friends. The idea that pain is inconsequential for older adults with dementia is simply not true. A third misconception is to think that the risk of treating pain in older adults is too high due to changes in organ function from disease or aging. Although it's true that care needs to be taken when prescribing pain medications, there are many safe and effective pain management strategies that can be used. In addition to careful prescribing, there are numerous psychological, physical, and preventative strategies for pain management that will be discussed in more detail in subsequent sessions. To summarize, there are many misconceptions about pain in older adults. Pain is common among older adults in part due to changes in the function of the nervous system with age. Treating pain is important for the well-being of both the older adult and the staff. There are many safe and effective strategies for pain management that can ease discomfort for older adults.